allergies, asthma, eczema, hay fever. Our immune system has many arms. But the major two ones that we know of is Th1 and Th2. And this arm is responsible for normal reactions to pollen, to food, to chemicals, to cats and dogs, to horses, to anything to dust mites, anything in the environment. Problem is, this arm is kept up to its jobs and strong by the gut flora. When the gut flora is abnormal, this arm becomes disabled. So the second arm, Th2, tries to compensate for its disabled brother, and it tries to deal with pollen and dust mites and cats and dogs and food and chemicals, but it uses wrong tools. And as a result, you become atopic. You start developing hay fever, reacting to pollen, asthma, reacting to dust mites, allergies to your beloved cat or your beloved dog, to chemicals, to foods, and the list just grows on. In order to get rid of this situation, we need to focus on the gut flora. Heal your gut flora, and this arm will get off the floor. Once you've rebalanced them, hay fever stops, asthma disappears. You're not allergic to your cat or dog anymore. I have many people in my clinic who can switch off and on their allergy to their cat like this by eating a particular food. If they don't eat that food, they can sleep with the cat right there on their face and they're fine at night. So allergies are curable as long as you focus on the gut flora.
Dietary components, potentially including specific micronutrients, influence the character of the gut, the developing microbiome. And this is now where her new research is going. Because what we know is that the gut flora is critically important to our health. We know that if children are born by cesarean section, they don't have as well developed gut flora as if they're born through the mother's birth canal.
When I started practicing as a medical doctor, we were diagnosing one child in 10,000 with autism. 10,000. Today, we're diagnosing on average one child in 35, 40 with autism. And scientists have already projected that line. By 2020s, between 20 and 25, in the English-speaking countries, we'll be diagnosing one child in 2. Half of our babies will be autistic. And that graph is not going to stop there. It will continue growing until majority or maybe all children will be autistic. Almost 100% of these children were born with a perfectly normal brain. These are perfectly normal children. But they acquired abnormal gut flora from the mother, from the start, and they acquired a heavy toxic load from the mother during pregnancy, these children. So when they're born, their digestive system is populated by pathogens which produce a river of toxins. These toxins get into the brain of the child and clog it with toxicity. How do babies learn? I'm sure majority of you have children. You watched your babies. They listen to everything. They look at everything. They touch everything. They take everything in their mouth. What are they doing? They're using their senses to collect information from the world. Their hearing, their vision, their tactile sensitivity, their taste buds, their smell. And then these organs pass that information to the brain to be processed. And from that information, the baby learns that this is mommy, this is daddy, I can trust them. This is a toy, I play with it like this. I don't line it up, I don't throw it, I don't destroy it. These are other children, I copy them. This is food, I eat it like this. But if the child's brain is clogged with toxins, it cannot process this sensory information. Information turns into a noise, into a mush in the child's brain, and from that noise, the child can't decipher anything useful. Autistic children do not learn that this is mommy and daddy. Mommy and daddy usually don't mean any more than any other human being around. They are known to pick up a hand of any stranger on the street and try to walk away with that person, with mommy running behind and screaming his name. They don't know what to do with toys. They don't know what to do with food. They don't know what to do with other children. What do we need to do with this child? We need to change the gut flora. We need to heal and seal the gut wall. Close all the holes in the gut wall so toxins stop absorbing. And once that source of toxicity stops, the brain cleans up. Human brain has a beautiful ability to clean itself up. It has its own detoxification system, microglia. It will clean itself up and it will start functioning. The child will wake up. The toxic fog disappears, and from that moment on, the child learns. So if the child is 2 years old, 3 years old, we can pull the child out of autism 100%. This will be a normal child, continue developing, learning, working, studying. But the older the child is, the less fully they recover, the more residual damage is left. But it is very, very individual.